Dr. Andreano today. We're going to talk a little bit about maintenance care. So oftentimes patients will come in because they're in pain or because they have some disease process going on, whether it be irritable bowel or headaches or diabetes, whatever it may be. They come in for a particular reason. But there's other times when patients come in just so they don't get in trouble. They don't have a problem. They want to maintain, just like going to the dentist. You don't go to the dentist just when you have a cavity. Same thing with chiropractic. It's not a bad idea to get in maybe once a quarter for most people when you feel just fine, preventatively, so we don't find problems creeping up that take a lot more work to handle, and you don't have to worry about the pain and the ache and the degeneration that may come along with those problems. So today I have Jenny. She's in from out of college, hasn't seen us in a while, and we're going to kind of take a look at her. She has no real complaints, but we're going to see how she's doing, so when she goes back to college she's feeling at her best, maybe less opportunity to get sick, maybe feeling a little better while she's there, so she has more concentration, studying, whatnot. And here we go. Okay, so this is Jenny. Jenny, how are you feeling today?
Good.
Any major issues?
No.
Okay, so go ahead and lay on your back for me, please. And I'm just going to do a real quick general exam. We're not probably going to show you all of it, but I'm going to go through and look at the muscles and how they're working. Hold that straight like that. Good. Hold this straight like this. Good. Hold this straight like that. And this one. And so what this does, we're looking at all the muscles to see how they're firing. Each muscle, hold that, helps to hold the body in position. And so if we have something that's not working the way that it should, then the body will be pulled out of alignment, which could interrupt the nervous system. Hold it there. And we don't want that to occur because the nerves control everything in your body. Hold that there. And if there's interference, hold. That was a little weak. Okay. If there's interference, and that's your latissimus dorsi, hold it there. It could affect organs, glands, or other functions in the body as to how they work. Hold that there, and drop that, hold it there. And now her lat has neurologically shares the same nerves with the pancreas and the spleen. So what I'm going to do is I'm going to just have you hold that right there, hold this right here. And so one does not really have to do with the other. If so, when I had her put her hand over here, that would have strengthened up. And so I'm going to have you put your hand right there. And this is a point for structure. Hold that nice and tight. And so that's just basically telling me, okay, no major problems, you're just a little out of alignment. However, if that misalignment continued to occur over a period of time, potentially the pancreas or spleen wouldn't function as well as it should, and you could have other health issues occur. Hold it there. I like your nails, by the way.
Oh, thank you.
Now I'm just touching over different points, seeing what's working. She's pretty good. Go on your tummy for me, please. And so when I touch over these vertebral areas, if I find an area that's not working well, hold that leg. Like right here, and I can push with just my finger, it's a little off. And that's because the bone is misaligned. This is where the trap attaches here and over here. And so if it's a little weak, it's probably pushed over this way a little bit. So that misalignment may cause that trap and other things to not function well. So I'm going to give you a little adjustment. Is that all right?
Mm-hmm.
There you go. Hold that there. Now, like we said in this segment, this is really, there's a little bit off right here. This is really looking at, but that doesn't really want to be adjusted. This is really looking at just a healthy person and how can we optimize that health and optimize that function. And this like that. Hold that there. And so here, instead of actually doing a real physical adjustment. We're just letting gravity put her hips back into place the way that they should. And while we're doing that, I'm going to give her a little bit of a massage to help the muscles relax and settle back into place. Pretty much concluded what we've done, and what I want to do is I want to go back and just recheck, make sure there's nothing else in here. So a little bit out right there, but again, that one doesn't really want to be adjusted. We'll come back to that. Hold that there for me, nice and tight into your body. Okay, so that adjustment got that muscle working, and one of the things she had actually told me was her neck was a little tight. That muscle pulls the shoulder down, and if it's weak, that shoulder rises up a bit, and that can cause tension in here. And so, but it doesn't really want to be, again, adjusted. Drop that. And so, if this muscle becomes tight, this muscle can become weak as well. We didn't really test that one. But these are some reflexes right here for the traps. And this will just kind of help these muscles shut down and relax a bit. And then once we've done that, again, I always want to go back and recheck my work to see, did we fix something or are we leaving things behind? Hold this here. And so now when we come into that spot, it's pretty solid. Sorry. And these are just a real broad spectrum, quick muscle testing to see if everything's working the way that it should. Okay, that's today. That is prevention, and hopefully she'll have a great semester at college. Have a great day.